Good afternoon, everyone. Oh, that's better. Did everyone enjoy their lunch? Yes, okay. That lunch was sponsored by Jackson Memorial Hospital and UHealth International. Let's give them a big round of applause for feeding us lunch. Welcome back, everyone, and for those of you who are just joining us for the afternoon, I have to tell you, you guys have missed some fantastic presentations this morning if you weren't here this morning. We had a great presentation on mental health in children. We talked about our healthcare ecosystem, and we also learned about e-health and the HSA's patient portal. And I'm sure that you all went on your lunch break and signed up for the patient portal. Yeah, got your flu shot. Maybe gave blood? No? Anyway, make sure if you haven't already done so that you do visit all of our exhibitors. We've got lots of fantastic supporters of the conference, and we couldn't do this conference without their support. So we need to give them a big thank you when you go and visit them. Make sure you say thanks for their support, because we wouldn't be able to put this on and offer it free of charge if it wasn't for our sponsors. Now, for those of you who were here in the morning before the break, I asked you to make sure on your lunch that if you saw someone in a black polo that said Healthcare Conference, they're our volunteers, that you would say thank you to them. How many of you managed to do that? How many did your homework? A few of you. A few. Okay. All right. So we've got another break coming up this afternoon. You'll have another opportunity to do that, because much like our sponsors, if it wasn't for our volunteers, this conference wouldn't be able to happen. So are you guys ready for the afternoon? All right. So we've heard some fantastic presentations already. We're talking about becoming empowered patients. And those of you who have been to the conference over the last few years know that every year I challenge you all to take away at least one thing, one nugget that you have learned that you're going to go away and apply in your life to make your health or your family's health or your loved one's health and well-being that much better. Has anybody got that nugget already? Or have you got too many nuggets to choose from? Yeah? All right, well, keep an eye out for that. Remember, last night we heard about what we need to do to make change happen. Dr. Botros talked about changes we need to make and ask ourselves, what is a change that I need to make? What would I have to do to make that change happen? What are the benefits of the change, and what are the risks of not changing? So those are some of the things you need to keep in mind as you're thinking about becoming that empowered patient. So we're back now. We're going to move on with our next speaker. We have Dr. Archita Joshi-Bhatt. Did I get it? Okay. I was trying to practice. She was helping me. So thank you very much for coming. She's a consultant pulmonology and critical care, head of infection control at Health City Cayman Islands. She's joined the medical team with over 10 years of experience in respiratory care. She's understudied and worked with world-renowned physicians and has sound experience in managing multidisciplinary critical care units. Facilities where she has gained expertise from are some of the leading JCI and NABH accredited corporate hospitals in India. In addition to Dr. Archita's medical background, she's also very involved with a variety of medical associations. She's completed the American Academy of Sleep Medicine with affiliated courses in sleep medicine, and she's held various workshops within her professional arena and presented papers on her areas of expertise. Her areas of special interest are critical care and diagnostic bronchoscopies. Ladies and gentlemen, she's going to speak to us this afternoon about advances in digital technology and empowering health. Please welcome Dr. Archita.
Thank you very much, Jennifer, for this very kind introduction, and a very good afternoon to everybody here. At the very onset, I'd really like to thank the Ministry of Health and the organizers of the Healthcare Conference, and of course, to my institute, Health City Cayman Islands, for giving me this opportunity to be here in front of this wonderful audience, speaking about a very relevant topic in today's world. And I'm going to be talking about advances in digital technology and how it is impacting our health and, of course, our healthcare system. So, to begin with, I have a question for everybody. What do we think health really is? How do we define health? Anybody who wants to answer that? I know it's not an interactive session, but all the same.
Energy levels that empower you to be productive and achieve
Very true. Actually, that's a better definition than the World Health Organization actually came up with. And well, the World Health Organization actually defines health not merely as the absence of disease or infirmity. It's not on the slide, don't worry. And it actually is a state of complete physical, mental, and social well-being, not just the absence of disease. And for that, I think we all need to be more cued to our health, more alert towards, are we in a state of well-being? And how can we actually empower ourselves to achieve that? And I think it's very relevant to talk about technology in this field. But before I do that, I'm going to probably just put forward what the universal health coverage goal that the World Health Organization, because we just talked about them, has put out for those who are not that fortunate in achieving healthcare. The very fact that we have a house full of people attending a healthcare conference goes to show that this island is really endowed with good, sound healthcare, and people are so concerned about their healthcare. There is an opportunity for people to come out and speak to their healthcare providers and talk about health-related issues, but there are many who are less fortunate in this world, and so there is still, healthcare is still a distant dream to achieve universally for a lot of countries and a lot of people. So just to say that there is a universal health coverage goal that the WHO has set out for us, and I think that the main key component to it is getting affordable healthcare to all. And I think technology can play a role in that, and that's why I think this talk is very relevant. And we are looking at, many barriers to providing healthcare universally. And those barriers could include social issues, political unrest, poverty, ignorance, basically people not knowing, well, this is a health-related concern and I should seek healthcare, and so on and so forth. But I think what is important is empowering patients or empowering a populace to know how can they actually achieve health or healthcare. And an informed patient, in my opinion, is, I think, the most empowered patient. There's nothing more you can do to a patient rather than giving them the information that they require to understand what is health and what is lack of health and what is disease and how they can help themselves. So patients become co-producers of their health once they are better informed. And there's no better way to do that than to promote health literacy. By providing high-quality information and, on health, disease, therapy options, we can actually empower our patients. And this just does not mean providing information. We also need to enable our healthcare environment. For us as physicians in the room, if there are any, I think there are quite a few of us, not many of us, and I guess all of us will agree that not many of us have achieved or have been taught in medical schools how to take care of ourselves. How do we empower our patients to understand how to take care of themselves? How do we educate them in how to use technology to help themselves? And I think that is going to be important in the future, that as part of our medical training, we should perhaps learn how we can empower our patients or educate them in self-care. So the role of the internet, of course. I usually say there was a time when mankind had 3 basic needs, and we all said that all you need to survive is food, clothes, and maybe a shelter. Not true anymore, is it? I think the basic needs have now expanded to include, of course, food, shelter, and clothing, but also electricity, internet, and of course, a mobile device in your hand. Right? So what is the role of this internet? It's all over. It's part of our life and our lifestyles. Obviously, it has a role in our health and healthcare as well. So what is that role? Well, the internet, in this era, we can see that people have increasing access to a wealth of information available online in the form of health forums, maybe blogs, or maybe in, websites which promote health and information on health. And the amount of information available is probably endless. One of the main uses of the internet, as I've mentioned there, is an encyclopedic information source. In many surveys conducted over a period of years, it has been found that the internet is being used by 60 to 80% of the users to probably perform some health-related research. So it goes to say that this, the internet has a huge role in our health and our healthcare because people are looking towards it to find answers to their problems. And what do we see there? The internet has the potential to educate and empower the health consumer by providing information on health and health services, and also in supporting self-help and giving them choices as to where can they seek this healthcare, what kind of healthcare do they need, and where would they best achieve their goals. So this is an important role the internet plays, but of course, we all know Dr. Google also helps us in doing a self-diagnosis. So you put your symptoms together, type that in, and do a Google search, and that tells you, oh, well, maybe I have this, this, and this, right? Don't we all do that? So, well, Dr. Google is a popular term we now use, which has been coined to describe when internet is used to seek medical advice. And why do people try to use Dr. Google? Well, they prefer the anonymity, because they can just put a question. They don't have to face a healthcare provider. They prefer the convenience. They can sit at their home, sit at midnight, and just type in something, and bam, they have a diagnosis, right? And of course, the quantity of information available. And we'll talk about some of the downsides of this later, but definitely internet has made a big difference in how people can access information on healthcare, right? But it's not just patients, it's also healthcare professionals. For all of us, and the physicians in the room will agree, that the internet supports professional health information, and for all of us, we find a lot of information on evidence-based tools, on guidelines, and have access to peer reviews and to discuss issues with our peers, discuss rare diseases with our peers, where we can actually have a forum. Despite geographical barriers, we don't need to really get in touch with somebody physically to get more information and to make our patient care, care more meaningful. So I think this is important, that healthcare professionals are also now increasingly using the internet to get access to each other, to get access to more information, to be able to access more data for research, and that makes a big difference to all of us. Now, coming to probably what we were going to discuss from the onset, and that is, how does digital technology, our everyday technology that we use, impact our healthcare scenario? So, well, worldwide, we keep talking about healthcare costs are going up. It's difficult to go through diagnostic tests. It's difficult to get doctor's appointments. We can't afford it, and a lot of people do not access healthcare for those reasons. But digital innovations now are making it possible to curb these costs, and they are actually providing easier access to people with not as many hassles that one would usually have with routine access to healthcare. And we can see how it helps. It helps in curbing long-term healthcare costs. It enables better healthcare outcomes. It also empowers both the patient and the healthcare provider with real-time data and connections with each other. So you can have access, and I'm sure speakers today, this morning, may have spoken to you about portal access and whatnot. So you have real-time access to your care providers, or at least immediate access to your care providers by connecting to technology. And enabling the introduction of new contributors to healthcare. So what is these new providers or new contributors to healthcare? Artificial intelligence, robotics. I mean, the scope is endless. There's so much of innovation in the digital world that healthcare is probably going to enter a new era now. So healthcare today has almost exclusively become electronic-based. So we don't really look at paper charts very often now. We look at electronic health records. We have clinical decision support systems to help make our decisions at the bedside. We have electronic prescription formats. And what all this electronic healthcare data is helping us do is accumulate information or data. And in this modern era, I think data is the key to future development or to future advancement. The more information we have on what are our issues, what are people actually looking for, what are the disease subsets or phenotypes, and how do people actually present with this kind of a problem, will help us understand how can we intervene in the future to get better diagnostic tools, better therapeutic tools. So data, I think, is the key here, and advancements in healthcare are tilting towards generating more data. And electronic healthcare, of course, helps us do that. So just brushing through what is this electronic healthcare, it's electronic health records, of course, and I think this has become a global phenomenon now, with almost 90% of the hospitals worldwide embracing electronic health records. And this is simply better access and easy access to patients' medical history, diagnosis, medications, their allergies, their lab tests, etc., to people who are authorized to view it. And then the ease of sharing this data with relevant healthcare providers who need to get this information through your basic healthcare provider. And EHRs actually enable us to do that very well. There's another thing that we should probably talk about in this context, and this is the new science of clinical decision support system. These are very intelligent tools. They help actually filter, organize, and present data that we collect from patient-specific data, from clinical guidelines, from computable biomedical knowledge, put it together and say, well, at the bedside, when the clinician or the healthcare provider wants to make a decision, what do I do next for this patient? It prompts you or gives you suggestions as to this should probably be the next best step to follow. And these are very intelligent systems which are increasingly available these days. And I think they have a great future in the future. Great future in the future. Not very intelligent. Sorry. Also, there is a form of artificial intelligence now called natural language processing. And I don't want to go into technical details. And I was just telling Jennifer, I'm not a technical person. So when I talk about all this, it doesn't sound good. But all the same, these are artificial intelligence systems which actually help us in, these are computer programs that help us process and analyze data. So when a doctor actually writes free text, depending on your historical record, or when we enter, okay, somebody has so-and-so problems, there are computer programs which can actually now read this and convert it into data and do data analytics on it and tell us, well, this is how this information is relevant and help us guide future treatments and plans. So right now, the main uses for these tools are basically speech recognition, documentation improvement, also data mining research that I just mentioned, and computer-assisted coding. So you don't need people who code, the procedures that you do or the diagnosis that you made, and the computer can do that for you. But there's obviously a very big emerging role, and this could probably have a good role in clinical trials, where they can match patients to the trial. It can have a role in phenotyping and biomarker discovery. So if you have a certain type of disease subset, the computer program can actually say, well, this is probably what you should look at, or club patients or club a particular disease subset into one and give us better information. Also, there is a new and emerging term that's actually more commonly used these days in our field of work, and that's called technology-enabled care. So when we put all of these various tools in our hands and look at how they can help us, a combined term that we could use probably is technology-enabled care. And this is a collective term for telecare, telemedicine, mobile health, digital health, e-health. You can put them all together and call it technology-enabled care. Now, what is this really doing? It is converging all kinds of available health technologies, including digital technology, media, mobile telecommunications, and helping us put together a good healthcare system which can also have impact on good social health. So healthcare still lags behind, of course. We talk about all these fancy things, but it still lags behind a lot as compared to other industries in embracing technology. And everyday technologies that we all use, cell phones, smartphone sensors, cloud storage, data analytics, can all help us in early disease prediction, in identifying symptoms and disease trends sooner, reaching out to the right people to get those sorted, so it's timely and more accurate diagnosis can be made using these tools. And of course, it can help cut down costs by incorporating telemedicine. It can also improve access, so people who cannot reach a doctor's office, who are probably disabled, who don't have somebody to drive them to a doctor's office, who live in remote areas, can use telehealth, or even remote monitoring. They can be at home and receive healthcare with the help of remote monitoring. So this has a huge role in cutting down costs and making healthcare available to more people. So, of course, when I talk about this, I have to talk about wearable technology. How many of us have seen or have been wearing a certain type of tracking devices, watches, badges, sensors? So wearable technology is the in thing these days, as we say. And all these sensors and NLP tools, they help us in capturing more data. So it's giving more data to people who are looking for it and can make more sense or sensible use of it. So of course that is helping. And of course it's helping an individual in tracking their sleep patterns, their health patterns, how much they walk, how much they eat, what is the calorie intake. So not just at the individual level, but as a society, as a populace, more information and more data is now available with the help of these devices. And this will help us in tailoring our healthcare delivery for individuals. So it's going to help us in evidence-based medications, in evidence-based care, help us understand what is it that people really require and how is it that we can reach out to them. And of course, this is the future. This is how we probably are going to progress in how medical science advances. And the delivery of healthcare and how health professionals are trained is dramatically changing. Probably the newer generation, when they get trained in medical schools, are going to use augmented reality, virtual reality. They're going to have more access to these newer technologies, and perhaps are going to become doctors of the sci-fi era, or the Star Trek era, where you have everything available with gadgets and robots doing it all for you. So probably that's going to happen in the near future. Now, just to look at how the global digital health market is growing, just to get an understanding of, are we really just looking at it theoretically, or is this really happening? And well, it is happening. In 2016, the global digital health market was $179.6 billion worth, and the growth is anticipated to be significant at a compounded annual growth rate of around 13.4%, and we are talking about globally, to reach $536 billion by the end of 2025. Adoption of these emerging technologies will, of course, require a high level of coordination, interoperability. So you can provide data to a doctor, but if they don't know how to incorporate that into your regular healthcare, it's probably going to be of no use. And so interoperability is very important in various sectors of healthcare. And the market research report here that I've mentioned has told us that the global mobile health market alone is going to reach a 20.7 billion mark by 2019. Now, just talking about the various forms of digital health that are available to us, talking about mobile health, how many of you have some kind of a health app in their phones now? Yeah? From tracking sleep, like I mentioned, to tracking how many steps you count, to how many calories you consume in a day, right? What medications, how you should organize your medications. So there are apps, you name it, and there is an app for it, right? And so mobile health is freeing healthcare devices of wires, cords, and enabling us to keep a track of our healthcare on the go. So it's truly technology in our hands which is helping us keep track of how we are doing. And smartphones and tablets also provide healthcare providers to more freely access and send information across to their patients these days. Physicians and service providers can use these tools to order medications, for documentation, and simply to reach out for more information with their patients. And just to look at the data, in 2015, and after 2015 alone, there have been some 153,000 new mobile apps which have been introduced. And the number that I could get from a latest study published in April 2018 was that worldwide there are around 320,000 mobile health applications. So you can imagine the amount and the volume of information available there and apps available there. Just looking at a report from Deloitte, and I'm not going to delve on it too much because this was published way back in 2015, but only between 2013 and 14, the study reported that there was a 70% penetration of smartphone technology, and in that 1 year, between 2013 and 14, 63% more unique apps were introduced in the healthcare scenario, just in that 1 year in the UK. And of course, significant global growth is predicted. And in 2018, perhaps the growth rate of just the global revenues from mobile health are projected to increase by 55%. So these are huge numbers. But what does it mean to us as patients, as healthcare providers? Why do patients or consumers or the general population, why do they actually access healthcare apps or health apps? The number one reason according to this research was that they want to find out what their symptoms mean. They want to find out, do I have some kind of ill health? And that's the most important reason why a layperson would want to have a healthcare app. The second reason why they would want to use it, and the second most common reason, was to have more information before and while they met with their healthcare provider, so that they could ask more informed questions. And what does it mean to a healthcare provider, though? So, having digital technology in your hands, what does it mean to us? So they surveyed healthcare providers and found that healthcare providers were happy to have digital technology as it minimizes avoidable service use. Patients don't come to you for every small little thing. They're able to sort out a few things by just communicating with you using a portal technology or a mobile health app. They're able to, there are improved outcomes of healthcare. There's, of course, this promotion of preventive aspect of healthcare. So people are looking out at health apps and trying to get in shape or get better eating habits or sleep better, and that is a preventive aspect of healthcare. And so healthcare providers were very happy with the promotion of digital technology according to this research. If we look at just this study again, if we looked at evidence of health technology, how is it benefiting providers, and we look at a mobile working solution for community nurses, and this is a study in the UK, they found that just using digital technology decreases 60% of their paperwork time. What does that mean to us, or what does it mean to the population? It increases the time that the nurse could spend for patient care or facing patients or meeting with them by 29%. So that's a huge change by just adopting technology. If you can do that, it's a better outreach to patients, yes? And what does it mean to patients? They found in this research that 75% of the UK's population now actually goes online to seek health information. And if you just look at how, they researched a subset of people and found out those with COPD and found out how did they find technology helped them? And 97% of the people reported high satisfaction from using technology in their healthcare needs. And 62% felt more confident in managing themselves once they were better informed or had access to technology to understand their symptoms. And 94% reported that they had better treatment compliance because they were better informed now. So it's playing a big role there. And again, mobile health solutions can solve a lot of problems, from the most simple to the most complex. You can have an app just to describe or just to track how you're doing in terms of how many calories you consume. Or you can have an app where you put all the data together and it helps you understand the complex algorithm, how your general health is performing. So the needs or the solutions provided can be simple to complex by these healthcare technologies. And I think when we're talking about technology, we have to talk about wearables, devices that we wear. And we all know about these watches we wear or Fitbits we wear. I didn't want to use a name, actually, but devices that we all wear. But these are getting increasingly unobtrusive now. So there are things that, you wear a watch, it's seen, right? But you can wear a contact lens now, perhaps, which can actually track your blood glucose levels. So that's smart. There are pills you can ingest, and that will tell us how your body actually metabolizes or absorbs food or medications you take. So the technology, the wearable technology, is getting smarter. You can actually have insole devices that tell us how much weight and pressure your feet are bearing and how is that impacting your gait or how you're doing. They can be patches which can monitor your heart rate and heart rhythm rather than wearing a Holter device. So technology is getting smarter and less obtrusive. And last but not the least, and well, I shouldn't say last, it's not the last, but telemedicine, again, is playing a big role in how we are reaching out to people. So it has a huge impact on how many people we can reach out to. And believe me, it has applications in all fields of medicine, whether it is cardiology, whether it's neurology, sleep medicine, and of course, radiology. I think the biggest role telemedicine plays in teleradiology, where you can have a scan done one place, but somebody sitting elsewhere, it doesn't have geographical barriers, can report it. And so this is a huge role that telemedicine plays. And in a large-scale study, which was published in the Chest Journal some time ago, it showed that patients in an intensive care unit, which was equipped with telehealth, had patients discharged from ICU 20% more quickly, and saw a definite 26% lower mortality rate in these patients, because there was around-the-clock cover by specialists who could remotely access the patient. And this is something we can really put to use. And there was a survey conducted by Deloitte this year, 2018, which actually surveyed and asked questions to US healthcare consumers and sub 624 primary care and specialty care physicians. And what were the results of the survey? Well, it shows us that consumers were very willing to use technology in actually, accessing healthcare, use virtual, virtual care, where they can actually have a virtual session or a virtual appointment with a doctor. They sit in their room and on their computer, the doctor is elsewhere, and yet they can communicate, talk across, discuss their problems. And 23% of the consumers who were interviewed had actually used a virtual care visit with a doctor. And 57% of those who were interviewed were willing to do so if they had an opportunity. But there is a barrier here, and if you look at this, physicians, again, are not yet ready for this, I think, and this is based on the survey from the US very this year, that only 14% of those physicians who were interviewed said they have actually implemented this technology and they are able to provide virtual visits to patients. And only 18% were actually in the process of acquiring this technology. So there is a disconnect, yeah? Patients are more willing to probably, or consumers are more willing to adopt technology, but not so much from the healthcare scenario. And what were the concerns that physicians had? So 36% of the physicians interviewed were worried that there might be medical errors when they use technology or telehealth, to access virtual care, to access patient-related issues. And 35% were worried that they may not have access to this kind of technology. Another 33% were worried about, is the data safe to transmit across? Is it, I'm going to probably breach on some kind of confidentiality? In terms of consumers, the only downside that they saw was 28% of them thought that they would have probably no patient-doctor relationship. They wouldn't be able to bind with their doctor. And 28% had concerns about the quality of care that they may receive. So again, in terms of other technologies, in the same survey, a lot of the general population was very willing to adopt wearable devices or to use technology for their healthcare. But unfortunately, only 53% of those who were actually accessing these technologies actually had shared this data with their doctor. And so that's not very good. So you have information, that's good. But not many of the patients who did this, or many of the consumers who did this, would actually share that data saying, okay, this is the status of my health, and this is what I'm doing. But they wouldn't really always share this with their doctors. And again, in terms of physicians, there was a huge disconnect. Only 9% of the doctors had implemented technology in their offices where they could actually make sense of that data that the patient was providing, from wearable technology. And only 27% of those who were interviewed were willing to adopt this in the next couple of years. So although everybody, both the consumers and the doctors surveyed in the study said, well, we understand that technology is very beneficial, there was a disconnect in how they could, implement it. And if you look at the lower part, again, same concerns that I had voiced earlier, that physicians felt, yes, this would improve access to healthcare, it would improve patient satisfaction, and it would, they would be able to connect better with their patients and caregivers. But in terms of consumers, they saw a lot of convenience. They didn't have to get up and go to a doctor's office. They didn't have to, actually ask somebody to drive them there. They didn't have to travel long distances. They didn't have to take a day off to get to their doctor. So this was definitely more accepted by the consumers that were interviewed. This is the same thing all over again. So telemedicine does have a huge role, and when implemented in the right way, virtual care can potentially replace part of the visits that people make to their doctor's offices and can help reaching out to healthcare easier for people. Now, if we just brush through other technologies, remember I said last but not the least, if you brush through other technologies, self-service kiosks can help in expediting your process of getting into the hospital, registering, etc. Portal technology, I believe already some things have been spoken about it. So portal technology allows physicians and patients to access medical records and interact online. Again, remote monitoring tools, so monitoring of a patient who's at home, monitoring a patient who's at home with an implanted device, monitoring a patient who uses a sleep device to help with sleep, like CPAP devices. These have been made possible by remote monitoring tools. Having wireless communications in the hospital, of course, goes without saying, are useful. And real-time locating devices, especially RFID tracking that more and more hospitals are implementing, is making healthcare more safe for patients. So there are unique identifications that can be provided to, radio frequency identification tracking that can be provided to a patient. And this can actually capture the patient's data, blood group, allergies. It reduces medical errors, increases the efficiency and productivity of a healthcare system. So definitely more roles for technology rather than what we initially talked about. But there are barriers. I just mentioned, not everybody is happy to adopt technology. Not all healthcare providers are comfortable with it. So what are the barriers really? Well, this was according, again, to that same research the Deloitte Center for Health Solutions conducted in 2018. And doctors, when inquired, when surveyed, said, well, why would my patient want digital technology? I'm around, why do they need it? Right? And they were also, of course, concerned about the quality and the quantity of data available. They were concerned about what if, this data is not secure, if I'm using technology and it's not secure. What if there is a medical error? What is my liability when I use technology? So there were many concerns by healthcare providers. And some of the main ones, like I mentioned, is potential for medical errors. Workplace doesn't offer the technology, so that was something that a lot of doctors said, well, I don't have access to this technology. And of course, security and privacy of patients was a big concern. Again, if we want to mitigate these barriers, if we want healthcare providers and physicians like us to accept technology better, according to the survey, again, the doctors and the physicians who were interviewed felt that if we could, take care of these things, perhaps they would be more willing to accept these, forms of technology. And 67% of the physicians interviewed wanted technologies to be more interoperable. So a patient provides me data from his mobile health app. How do I capture that on my electronic health record? How do I understand that, this is what the data means? So the interoperability between systems is perhaps something that all physicians would really want to make more sense of the great amount of data that these devices and technology is now generating. So that was one major thing that can be addressed perhaps in the future. And 51% of the physicians interviewed needed more training to use these technologies. And I think I can empathize with that. So it's always helpful to have more information, know how to access that information, and how to make good sense of it. If you look at the global scenario today, we have a lot of data, but it's all going wasted. So if you just look at this little chart here, US, which is the biggest neighbor next door, is ranked the first in healthcare spending, but only 37th in how the quality of healthcare is addressed. And if you look at the amount of data in terms of money wasted on missed opportunities, unnecessary, error-prone, and incidentally delivered services, it's to the tune of $585 billion. And worldwide, that could amount to almost $7 trillion. So 80% of the world's healthcare data today is unstructured, and it's not being utilized. So this is the reality. We talk about technology, we adopt it in our daily lives, but the reality is that there's so much information out there that we are still not accessing or able to access, and there's a great role for developing this field. Again, very technical, but there is a nice company called Gartner, which is actually information technology, a company which generates trends, or which actually predicts trends in how each field, and this could be in any industry, adopts technology and creates a model which is called the hype cycle, which tells us where is this technology standing in this particular industry or in this field. And if you look at the hype cycle for the year 2014, you would see that electronic health records, remote patient monitoring, healthcare social media or wearable technology was just climbing this phase where the technology was being triggered. And today, if you look at the 2018 cycle, look at where it's reached. So it's where it's reached the plateau of productivity. It has gained popularity, acceptance, and is now being actually used. So, this goes to say that technology has come a long way in the last few years and has a long way to go still. And of course, there's an increasing interest of the healthcare community. So I just talked about doctors being reluctant, but that's not really true, If you look at a lot of new publications that we have, there's a lot of mention of course, this is 2009, but then we talked about cell phones. Now we talk about regulating this revolution. We talk about, how do we actually control the information that's being put out there? How do we, channelize it? And so the trend is changing. So there are people who are looking into this, researching this. Of course, a role in social medicine where digital health is being helped to, pick up patients early when they have a diagnosis of, say, HIV in the community, an infant born with it, or so many other things. But it's not all good. When we talk about technology, of course, everything that we usually, start talking about cannot be all good, right? There is a downside to when we use technology in healthcare. And what is the downside, really? Not much, but when we actually look at the data and review 79 studies investigating the quality of the information available online, there was, when we actually looked at these people, the meta-analysis that they conducted, they actually looked at the quality of the information available. They found that the methodology and the rigor with which these studies were actually scrutinized or, done, they varied widely. So obviously, the data, the outcomes that we got from these studies were also very variable. So how do you trust the particular information that you get online? Actually, you need to take everything that you get online has to be taken with a pinch of salt, because not everything can be reliable data. And looking at this, the information sometimes, in some of the studies we found, that was often incomplete and sometimes inaccurate. And again, according to this research by Eisenbach and Kohler, they found that a lot of patients who were, or consumers who were interviewed said, well, I did look at the credibility of the website. I think I got the right data from the internet. But when they were asked, what is your source of information? Not many of them really recollected where they got their information from. So it goes to say that, not always what we see is going to be credible information. And even if it is, not many of us pay heed to it. So that's something that we need to improve with education. And I think the difference and that the internet is making to our lifestyle and to healthcare these days is more of quantity and the ease of access, maybe not so much of quality. So that needs to be assessed, really. Although good quality information is obviously available, but not many people may be able to differentiate between good quality information and probably inaccurate information. Again, education of consumers or the content providers and probably regulating them will help mitigate this problem. Now, there have been isolated case reports where individuals have actually harmed themselves by using the internet for self-diagnosis, or have tried to do something, and that has led to harm. And so there is an increasing interest in creating databases. The University of Heidelberg, this is in Germany, they actually created a database of adverse events related to the internet. And they are at present collecting data. And it would be interesting to have more such registries, because it would help us understand, our people to be able to report, well, they were harmed when they used, poor quality data that they researched online. And this would help us understand the extent of the harm that potentially wrong information can cause. Again, there are concerns of the lack of professional moderation or facilitation of all the data that's available online. Again, like I mentioned, there is no way to regulate this data, not yet at least. There are a few health apps which have been probably approved by the FDA or by certain other accrediting authorities, but not many out there. And not many of us actually look at the credibility when we use these apps or websites. And so I think this is something that should be coming up in the future. The study I showed you from BMJ actually talks about it, that we probably need to regulate this revolution before more harm is done to people or consumers who are using it. And of course, there is this risk of internet addiction and of cyberchondria, as we call it now. So you may, not trying to be critical of anybody, but there are a lot of patients who come across with information printed out and say, well, maybe I have this, this, and this condition. Would you want to look at it? And well, this has been proved to be useful for a lot of people who do that. But there is evidence that this can actually become an addictive habit for people who are otherwise well, but just tend to worry about their health. And this is a condition we now know as cyberchondria, where the worried well keep looking for problems in their health, and it's easy to find these problems on the net. And they come to you with this internet printout and say, I probably have this condition, and I need you to find out if I have it or not, right? So I think this is taking the technology to the other extreme where we don't need it to be. We probably need to use technology to help us get that information and then verify it with our healthcare provider. So again, internet use can become addictive. We all know, as it's becoming more ubiquitous. The use of internet is increasing. More and more of us are probably always on our phone or on our laptops or on our iPads and looking through things, researching things. And this habit can become addictive. It can lead to social isolation, can lead to depression, and can be, of course, detrimental to work and social life. Again, there can be harms from self-diagnosis. I think I already touched upon it, so I'm just going to rush through. But search engines, again, often provide information of the most serious type of problem that you may have with a particular symptom subset. So you type in headache, and this was a research actually done by Microsoft, that if you typed in headache and looked at a symptom search, I'm sure some people are already doing that, the probability that you'll come up with a diagnosis of brain tumor is almost as much as the diagnosis of caffeine withdrawal. So you can imagine that you can make a self-diagnosis of a serious nature, whereas that may not be the case. It's one of the differential diagnoses, one of the possibilities, but that does not mean one has it, right? So a lot of people get sometimes carried away in making self-diagnosis and then can potentially harm themselves by making the self-diagnosis, making a presumption, oh, I'm going to die of a brain tumor. Let me just have this particular drug. It's going to take away my pain and going to give me a good quality of life, and end up having more serious problems, probably get addicted to substances that they're using to relieve pain, and perhaps miss the original diagnosis altogether and end up with more harm. So again, most people who do these searches don't know how these search engines work. And so, you have to take everything that you get has to be taken with a pinch of salt. But that's actually not what happens. So a study from Walter Kluwer actually found that 63% of the people who sought information from online actually reported that they've never been misdiagnosed. They always get the right diagnosis online. And that's actually unfortunate. Again, why? Because the next research actually showed us that only half of the people who actually got information online went ahead and discussed this with their healthcare provider or tried to verify this information, which again goes to say that a lot of us who search for things online make a self-diagnosis and try to intervene by making maybe changes in the diet that we eat, making changes in maybe over-the-counter medications we take, and this can potentially be harmful. So in most cases, people believe what the search engines have told them, and they might act on that information, like I mentioned, and lead to more problems. And primary problems may remain unaddressed and become more serious in the meanwhile. So what is it that we as physicians, or as doctors in the room here, can do to help with improving what patients get out of technology? I think as physicians here, we have a big role, or healthcare providers for that matter, have a big role in trying to channelize this technology to good use for the patients. And if you look at that, most physicians have now agreed, no point in shunning technology. There's no point in saying, I'm right and I know it all. If you can't actually drown the chorus, you have to join it, right? So we all agree now, and it's very important for us to understand a patient's or a person's motivation behind this research, acknowledge it. Well, it's good that you're trying to research your health. It's very important that you're trying to help yourself, but also to guide them in the right way to access the right information online. So I think that is very important. And so a doctor-patient relationship in today's world can follow this trend. And I think it could be something that health profession says, well, I'm right, I'm the expert, this is my opinion, and that's it. And that is called a health professional-centered relationship. And not many patients are very happy with that. If I ask you, would you be happy if your doctor told you that? Not really, right? So I think this trend has to change, and a lot, as a result of this kind of a relationship, patients go out of their consultation perhaps more disgruntled and say, well, I'm better off at finding out what's wrong with me. And this leads to more problems, obviously. And so a patient-centered relationship is perhaps ideal, where the healthcare provider sits with the patient, sits together and researches what could be the possible problems, what are the possible solutions, and then try to achieve or arrive at a common consensus. Having said that, it's ideal, but difficult. So I think what at least all of us as healthcare professionals can try to achieve is an internet prescription, that at the end of an appointment, at the end of the discussion, we can actually guide our patients to some reputable websites or references that they can actually research, read upon, come up with their own thoughts, and discuss it again. I think that's most useful. And it's high time that all of us and healthcare professionals actually started using at least this, or even better, the patient-centered relationship, so that patients can get more out of their healthcare visits and more information out of their healthcare visits. Again, take-home messages, and at the end of the long presentation, you should have at least 10 points to take home. There are fewer right now. So as in other aspects of our lives, technology has become an integral part of our healthcare as well. And digital health can help in a long way and in a big way at curbing costs in long-term healthcare costs. Technology-enabled care provides patients the ability to self-manage their health and both their well-being. Technology empowers patients and carers to compare providers, their quality, their prices, and make informed choices. Technology-enabled care, or what we now call connected health, empowers both the patient and the healthcare provider with real-time data and, of course, real-time connections. So you can perhaps, if you have access to technology, talk to your healthcare provider, get information, even without having a formal appointment. It enables the introduction of new contributors to the healthcare ecosystem and has a role in both individual health, in social health. Like I mentioned, there was this research in UK where a social nurse, a healthcare providing nurse, had more time with her patients. So it has implications in social health. And technology is always complementary to clinical science, and at least in the foreseeable future, we don't see Dr. Google replacing a healthcare provider yet, right? So I think we should all rest assured. We still have our jobs here. So at least in the foreseeable future, we are not going to be able to substitute years of training and years of clinical judgment and seeing patients and dealing with them. But yes, technology can be complementary to healthcare. I think this is the message we all want to take home today. And if there are any questions, I'm happy to answer.
We do have time for one or two questions. Were there any questions for Dr. Archita? That was a fantastic presentation. I think the Dr. Google thing is a very current concern, certainly for healthcare providers, but I think also for us as patients and parents and so on. I think one of the interesting things was the search result for a headache that would come up with brain tumor or caffeine withdrawal. I can say that mine is more likely the caffeine withdrawal if I hadn't had my cup of coffee. Were there any questions out there? No? Okay, can I ask for another round of applause for Dr. Archita? So again, thank you so much. That was a fantastic and informative presentation. Lots of food for thought, some things for the healthcare providers to look at and see if those are the barriers to their implementation, and some pointers, I think, for the patients in the crowd in terms of when they go and approach Dr. Google and ask him what's wrong. So as a small token of our appreciation, sponsored by Kirk Freeport, a little speaker gift for you. Thank you very much.
Thank you so much. Thank you.
How's everybody doing? Awesome. Yeah, fantastic. There's been so much amazing information today. It's just incredible. Before you disappear for your workshop, or stay here, as the case may be, we are now going to get Pinnacle Media to come and do the draw for the Fitbit Versa prize pack. Appropriate, we'll be doing this after the presentation on technology and wearable technologies. Is a representative from Pinnacle in the room? No? No? Nope? Okay. All right, so after, if we do find them, we'll do the draw. So the next session we have are our breakout sessions. So there's two different topics that we're going to cover. We're going to have one in this room, which is going to talk about taking care of the elderly. That's a session that's been very generously sponsored by the Ministry of Community Affairs, and the CEO of the HSA, Ms. Lizette Yearwood, will be facilitating and moderating that. The other workshop or breakout session is called Managing Cancer Follow-Up Care. That's been sponsored by Baptist Health International, and that'll be in the Rembrandt room. So the Rembrandt room is the room where you registered when you came in initially, so it's a right and a right. Try not to get lost in the gift shop on the way by. So that's the Rembrandt room, and I'm going to be moderating that. Those sessions are going to end around 5 o'clock, and there'll be a coffee break through that. Don't forget to visit our exhibitors and thank them for their support. Remember to get your flu shot. I want you guys to join me, please, in giving a big round of applause to everyone we've heard from so far today. It has been an absolutely amazing day so far, I think. So if you're staying here for the elderly, I won't see you guys again until tomorrow morning. Tomorrow morning breakfast is at 8:15, and it's been sponsored by Cineco. We're going to have Sutton Burke, who's going to open tomorrow with a presentation on Mind Care 101, how to ask for help, what to expect, and steps to sustain change at 9 o'clock. We're also going to hear from Dr. Joseph Scott, who's going to talk about when to go and when not to go to the ER, which will be very interesting. And then we're going to have a presentation by David Greenberg, who's going to talk about the empowered patient and the internet, a physician's challenge. And then Minister Seymour will be here to bring it on home. So if I don't see you in the workshop this afternoon, everybody have a wonderful afternoon, a great evening, and I'll look forward to see you guys first thing tomorrow morning. So stay here for the elderly care, get up and move to the Rembrandt room for cancer care. We'll see you there. Thanks very much.